Hi there, everyone. My name is Chris Raycamp with the UMKC Innovation Center's Technology Ventures Studio. Today, I'm joined by Dr. Shelley Cooper, the creator of the Come On Now platform, and we are here to talk about the Comeback KC Ventures program and her platform in order to bring solutions addressing the pandemic to life within our community. So Comeback KC is a joint venture between the UMKC Innovation Center's Tech Venture Studio and KC Digital Drive, specifically to do just this, to support entrepreneurs that are doing innovative things to lift our pandemic or our community out of the pandemic. So Dr. Cooper, thank you so much for being here today. And please tell us more about the Come On Now platform.
Well, Chris, thanks for having me. And thanks for the opportunity to share the Come On Now platform with your listening audience. Let me tell you, the Come On Now platform, the purpose of it is to replace no-show and late cancellation medical appointments with telehealth visits. That was the initial mission of the Come On Now platform. And since that time, of course, the pandemic hit and a lot of doctors' offices weren't scheduling face-to-face visits. A lot of patients weren't safe or didn't feel safe or comfortable going into the doctor's office. And so as a result, telehealth kind of blossomed and bloomed. So what we found is that there are a lot of families with young ones, preschoolers, who weren't bringing their children in for their early wellness visits. They weren't getting immunized, they weren't getting screened, and therefore they weren't kindergarten ready. And so as a result of the pandemic, Head Start, the Mid-America Regional Council Head Start location here in Kansas City, aligned with Swope Health Services, who is their clinical partner. And they were looking for an innovative way to invite parents in to have their children conduct those early wellness visits with the kids. And so HRSA put out what was called a P4 challenge. And please don't ask me what those other P's are for, but I think pediatric is in there somewhere. The main focus of it was a nationwide competition between different organizations to see what type of innovative solutions can be brought forth to solve this problem with early wellness visits, immunizations, health screenings, and so forth for Head Start and preschool age kids. And so 274 organizations were in competition with it. And I'm happy to say that Diversity Telehealth, the Come On Now platform, Head Start, and Swope Health were in the final 20 and received some funding behind that. So that funding is to be used for incentives for parents. It doesn't go directly to the Come On Now platform, unfortunately, but it does allow us to present ourselves in schools. Right now, we're working with Excelsior Springs Early Childhood Center. We've had February, March, April, 3 opportunities to sign up parents onto the Come On Now platform. We've also partnered with Emmanuel Family and Child Development Center, which is located in the center of the city on Prospect and Martin Luther King Boulevard, also supported by Swope Health. We're working with Vibrant Health. Vibrant Health is on the Kansas City, Kansas side, and they're looking to fill their open slots as well. I think the pandemic has affected so many people in so many different ways that having an innovative solution like the Come On Now platform that can be used on your phone. It also has an admin panel where the schedulers are using that. We're connecting it to the electronic health record, which in this case is eClinicalWorks. So a long answer to a short question. The pandemic has wreaked havoc not only in loss of life, but in lockdowns and loss of revenue. But we are trying to reverse that in a small way and make sure that these preschoolers and Head Start kids are getting their kindergarten screenings and they're ready for kindergarten in the fall.
Well, that's amazing work and clearly really, really important. I think each of us has experienced, little parts of the hardship of the pandemic, and it's hard to, understand each one of these. So it's so important that we have folks like yourself that are diving deep, partnering with local institutions, like you said, to support at this point, preschoolers and making sure our kids are safe and getting the wellness checks they need to go into the next step of education. As you're working with these institutions and families, what have you learned about the effects of the pandemic on them, and what feedback have you gotten in terms of your platform supporting them at this critical juncture?
Well, to answer your first question, most of the parents just want a sense of normalcy. They want normalcy for not only for their families, but also for their children's educational experiences. This is their first opportunity to present their children in an educational setting, and they want it to be safe. They also want it to be fun. They want it to be a happy learning environment for the kids. So what we're doing is we're trying to meet that medical need. So when, say, the nurse Chris at the Excelsior Springs Early Childhood Center invites the families in, there's a mobile medical there on site. There's mobile dental. They're setting up an actual clinic room at the site, and SWOPE will have a community presence there within the Excelsior Springs area. And I forgot the second part of the question.
No, that's perfect. And anything you're hearing from the folks that you're serving in terms of their experience with the platform and kind of what are you excited about from these folks getting them on board?
Well, what we did was we put together a 3-part survey in a Google form, and then we randomly send out those Google forms to those questionnaires to the families after they've signed up and they've had an opportunity to not only enter their own information, but their children's information. The platform asks them for a picture of their child, first name, last name, gender, birth date. And so once they enter that information, I'm actually able to see it on my admin panel, and I show it to the parent and let them know this is what it looks like. It's completely safe. We are going through HIPAA compliance. So we're trying to avoid any type of data breach. And so not only are they appreciative for the opportunity to have that patient engagement with not only SWOPE Health, but other federally qualified health centers, they're also happy to learn that it's easy to use. That's been the #1 phrase that we've received on our feedback, that it's easy to use. And so that's helpful because we know that when in doubt, don't. And that's what a lot of parents do. If they don't think it's safe or they don't think it's easy to use, they're going to delete it from their phones, and then we've defeated the purpose. So we're excited to hear that news.
That's absolutely fantastic. Yeah. And talk more about, I guess, the way that this community has supported you thus far, and really more importantly, what support do you need from the Kansas City entrepreneurial community or health systems in order to continue the work that you're doing that's clearly highly impactful at this juncture?
Well, we've gotten a lot of support, especially from the Comeback KC. We've had meetings with advisors that have been amazing and invaluable in going forward, because as a CEO, we're the idea makers. We're not necessarily the experts in the operations of the organization. I'm a member of Pipeline Entrepreneurs, and that's been very helpful, along with the Tech Venture Studios. And we received funding from Digital Sandbox. We have advisors from the SBDC, Sally Williams and Joe Meyer and Rebecca Goebbels. I'll just give a shout out to them, as well as Hush Blackwell has been really helpful. We participated in Get Started Omaha a few weeks ago, and our company was the only company from Kansas City to make it to the final round. We didn't win, but there's always next year. So we've gotten so much support, along with Kauffman Foundation. I don't know if I mentioned KC SourceLink and all that they offer. So it's just been a wealth of support. What we could use, since you're asking, what we could use going forward is introductions to decision makers at healthcare organizations, those decision makers who are interested not only in continuity of care for their patients, but also recouping lost revenue from the no-shows. And those organizations are interested in having higher quality measures, because seeing those chronic disease patients more frequently sometimes meets some of their quality measures that they've put out, that they report not only to the state, but also the federal government. We're also looking for investors, angel investors. We're in a pre-seed round that we're starting in the next few months. So I'd be happy to have coffee or hot chocolate. I don't drink coffee, but I'd be happy to meet for an early visit and just talk about what we're doing and see if there's some synergies with some of the local angel investors. That's what we need.
That's perfect. Thank you, Dr. Cooper. So intros to executives at healthcare organizations that might leverage this platform for all the reasons we talked about today, and investors potentially interested in your pre-seed round and starting that network. Generally, we're just really excited about what you're creating. We're so glad that you're a Comeback KC Fellow, and we want to continue to support your efforts. Thank you, Dr. Cooper, for your time.
Thank you so much. One last thing, we
Sure.
are putting our platform in Spanish. So we have reached out to the Spanish speaking community. So maybe connections to Spanish speaking organizations that might have a need for our platform would be helpful as well.
Oh, fantastic. Yes, absolutely. Thank you again, Dr. Cooper, and we will talk soon.
Okay, thank you.